All right, folks.
Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there's one additional death related to COVID-19, and I'd like to extend my condolences to their family, friends, and loved ones. The current 5-day test positivity rate is 8% provincially, 6.9% in Winnipeg, and as of 9:30 this morning we have 74 new cases to report. Our case numbers continue to decline. Our vaccine rates continue to rise. However, we're still seeing the effects of this virus. We still had 9 deaths reported just this weekend alone. We also continue to see that strain in our hospitals. We know that despite these declining cases over the past week, we still expect hospitalization and ICU numbers to remain high for the coming weeks. It continues to be up to Manitobans to take the steps needed to protect each other. Everyone needs to get vaccinated as soon as they become eligible. If your first shot was on or before May 12, you're eligible for your second dose, so please book that as soon as possible. It's been us working together all along that's been able to bring down these case numbers and help bring an end to the third wave. We need to continue to practice those fundamentals going forward. We see that COVID is still with us. We still have too many cases. We still have a significant strain on the healthcare system. So we do need to continue to be mindful of those fundamentals, and now added a new fundamental is to be immunized. We know that donating blood is still very essential, and donation continues to be safe, and there certainly is a need. So if you're a regular donor, your ongoing commitment is very much appreciated. If you're new to blood donation, please book your appointment through Canadian Blood Services and help save a life. So thanks again to all Manitobans for all of their work, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Canadian Press, Kelly.
Hi, Dr. Roussin. Are we seeing longer hospitalizations and intensive care unit stays during the third wave with the variants of concern being dominant? Because it appears that we still have quite a few Manitobans receiving care outside of province.
So we do see, quite a range especially in ICU care. We see the number of, a certain proportion, probably about a quarter of patients that have relatively short stays. And then some that have sort of that average length of stay in that 2-week period. And then we have about a quarter of patients that have very extended stays. And we did see that in the second wave too. You note that we had very good numbers between our second and third wave for a relatively extended period of time. But we still never got those ICU numbers significantly down. And that's because of those lengthy stays. So we do see that. And that's why we, as our case numbers come down, we know we still have that strain on the healthcare system, so we still have to be very mindful of that.
And are you able to speak about the slowdown in Pfizer shipments and what that means for us hitting our reopening plan goals, especially considering the pause on youth vaccinations? I know this weekend Alberta and Saskatchewan moved forward with reopening plans and loosening restrictions despite not meeting their goals. So with the slowdown in Pfizer, what does that mean for us here?
So I'll let the task force discuss the specifics on it. I think that, vaccine supply, has always been, our rate limiting step here. And so we're definitely watching that closely from, we've met our target for our first stage of reopening plans now. And as we move forward, we're going to work with whatever vaccine we can to meet further targets. But the task force will have the specifics on exactly what that means to our program.
From CTV Winnipeg, Michelle.
Hi, Dr. Roussin. Just wondering if you could elaborate a little bit on whether or not, when the public health orders expire at the end of this week, could we potentially move into that reopening that was scheduled for July 1st earlier? Are you considering that?
So we have a lot of things we're still considering at this point. There's going to be, on Wednesday, we'll have more details to share on that.
Okay, thank you. I also have a question here for you on personal care homes, letting people in for visitation. What went into that decision with the vaccination, double vaccination?
Yeah, and so, we want to find those ways to, to have benefit from the double vaccine. We do know it's certainly no intervention is 100%, but there's significant protection from being doubly vaccinated. We know that there's been a lot of challenges through this with difficulties with visiting loved ones and friends, and so we thought this was one way to safely expand that.
From City News, Mark.
Good afternoon. We went to the Shoppers Drug Mart vaccination site this morning, and there were hundreds of people. The ones we talked to seemed really excited about the opportunity to try to get a Pfizer vaccine. There was a 500-person cap, it seemed, so hundreds of people were sent home. Can we tell them anything about when maybe Pfizer vaccine opportunities may return in the province?
Yeah, so the details on that I don't have right now. We're still working with all of our partners on that, and we think our vaccine program is going to continue to roll out effectively, but I don't have any specifics to share on that.
The people we talked to did seem to express some hesitancy still around mixing. There was optimism that they could get 2 Pfizer doses. I wonder if you could just speak again to why you feel it's okay to be mixing these vaccines, and how maybe you would talk to the Manitobans who tried to get one today but couldn't.
Yeah, and so the just in dealing with vaccines in general, we have a lot of interchangeability between a number of different vaccines in our routine program. So just in general, we know that is typically acceptable, and now we have studies that support that. We know that, say, Pfizer and Moderna are really the same vaccine, the same delivery mechanism, the same mRNA vaccine. So we're not concerned about the safety or effectiveness of the interchangeability of those, and so it's certainly there as an option, and I would again take that vaccine that's available, and we can be sure that interchangeability is safe.
From CHVN, Taylor.
Hi, good afternoon. When you do announce the health orders on Wednesday, should we expect a regional approach or a provincial approach?
Yeah, so we haven't fully decided. We haven't made that decision exactly yet on what the specifics will be. So stay tuned for Wednesday, and we'll have some of those specifics to share.
Thanks. And as you know, we have reached those first vaccine targets, the 70 and 25%. But is our case numbers going to affect these health orders?
Well, so we've been talking all along that, whether it's vaccine rates, whether it's test positivity, whether it's hospital admissions, we don't look at just one indicator when we're taking these things in consideration. So yes, we met those vaccine targets. And, so hats off to the vaccine task force and Manitobans for getting their shots. But that's only one thing that we're considering when we're looking at our reopen plan. So we do have to look at these numbers. We have to look at that strain on the healthcare system and really put that all together for, how we could open up in a safe manner.
From the Winnipeg Free Press, Danielle.
Hi, Dr. Roussin. Alberta and Saskatchewan say they are prepared to move forward with a broad reopening and removal of public health measures on July 1st and July 11th. Do you feel pressured to move faster with Manitoba's reopening plan, especially since Manitobans could travel to those provinces and take advantage of the opportunities there that will not be available here at that time?
Yes, I wouldn't say it's pressure. We're looking at our own epidemiology. I think it's certainly relevant. It's always been relevant what other jurisdictions are doing. So we watch that closely, and we'll be watching, how they roll out their reopenings. But we were late to the third wave, so we're weeks sort of behind them and on coming out of the third wave, and so we're going to have to do things that are based on what we're seeing here and where we are. And then move forward cautiously, but definitely we'll be watching what other jurisdictions do and the successes that they have.
And do you think that those plans are sustainable and beyond coming out of the third wave? Is there something happening in those provinces that allows them to move more quickly than us? Is there perhaps something that public health can do here in Manitoba to facilitate a speedier reopening?
Yeah, and so again, it's not really all that quicker than us because remember we were late to the third wave. So while they were peaking in the third wave, many of them, we still had lower numbers. And so we peaked later and are sort of weeks behind when we coming out of our third wave. So we have to do with what we have here, and so that might put us on a different time scale than them. But it's if you compare the sort of the lengths of the third wave, we're still on track.
From Global News, Brittany.
Good afternoon, Dr. Roussin. More on Danielle's point there, when we do look to the West and we look at their specific targets that they had to reach for reopening, ours are much higher here in each phase. Why did we take such a different approach on such higher levels that needed to be met than any other province?
And so, I think that it's also the timing of when the plans were made. Because we were later in the third wave, we were later to start looking at our plans, and so we had the benefit to being aware of that of the Delta variant. And the effects that it has and the requirements for the 2 doses with it. So I think our reopen plans have the opportunity to really consider the Delta variant. Now, of course, we've always looked at what's happening in other jurisdictions. We're going to be watching very closely the successes they have with their reopening plans. And be looking to see if transmission increases or if there is any issues with the Delta variant with those reopen plans, and so we'll be watching quite closely as we all move forward.
And when we released the targets of the first and second dose, it made it tangible for people. It was something that they could look at and know that when we hit it, we could start hitting that next phase of reopening. Why not share the other specific factors that need to happen and what those trigger points are so that people know what needs to be reached for reopening to happen?
Yeah, and I think that the real issue with that is that with a vaccine target, we sort of have that measurable target. The 70% to 25 second dose. We can see that from the modeling. We see that from what we know with transmission dynamics and population level dynamics with vaccine uptake. So we can sort of have those set goals. The other indicators, it's really hard to say because they don't act independently of each other. So if we have a certain case number, if we have 100 cases in a day, but we have a 14% test positivity, then we know that's different than 100 cases a day with a 3% test positivity. So we can't necessarily just have those set targets on those other ones because there's a lot of interworkings between them. So we look at the trends, we look at, at all of them in the context. So it's really tough to be bound to, say, a specific test positivity because at any level of a test positivity, there could be variables that still don't look favorable, or there could be ones that look quite favorable. So it's really tough to set those targets out.
From the Brandon Sun, Tyler.
Hello, Dr. Roussin. Thank you for taking my call. On Saturday in Brandon, there were 200 first-dose vaccines available at a walk-in clinic. I was wondering if you know what kind of uptake there was during this event or similar such walk-up clinics. And what do you think of the Winnipeg Jets and Manitoba Moose involvement in the day?
So I don't have any details on those uptakes. I hear just anecdotally about lineups and successes for these. So it's very encouraging to see Manitobans really excited about getting vaccinated. They're all seeing that this is our way to a post-pandemic Manitoba. So it's quite good to see. And as far as help from all partners, including Jets and Moose, their help with trying to increase uptake of vaccine is much appreciated, and I think Manitobans are seeing that this really is our way to get to that post-pandemic Manitoba.
Thank you, sir. And my follow-up, I'm thinking about those fueled by misinformation and fake news who share all manner of nonsense about COVID that just frankly is not in the realm of reality. Is there anything being done to target them specifically?
Misinformation certainly has been a growing issue, especially with social media, and it's certainly been a huge issue with the pandemic. And so we try to get as much credible information out as possible. We try to direct people to trusted people, so their healthcare providers are there to provide advice on all sorts of things, including things related to the pandemic. And so it's really just trying to get the message out, and really want to just work with people who are hesitant about anything with the pandemic or with the vaccine. Try to address their concerns, not dismiss them, and try to move forward and show the real benefit of the fundamentals as well as the vaccine.
From CJOB, Will.
Good afternoon, Dr. Roussin. I'd like to ask you about these rapid antigen tests that are being provided by Health Canada. Shoppers Drug Mart just announced they're available at locations in Manitoba for employers. What level of confidence do you have in these tests, and are the results something that our public health would accept?
So there's a couple of things going on right now. We've had some pilot projects with some employers on using these type of tests and trying to work closely with them. Typically anyone who would test positive would be directed to have a confirmatory PCR test, which does get reported to public health. But again, it's sort of the public health approach. It's a multi-layered approach. So we're not going to be able to test ourselves out of a pandemic, but it is one measure that can occur. We still need people to stay home when feeling ill. We still need people to practice the fundamentals. We still need people to get vaccinated. But on top of all those things, if we have testing available that's easy and accessible, that could be an added benefit to it. But again, it's not going to be the end-all and be-all. It's just one step in a multi-layered process that requires Manitobans to continue to be aware of this virus.
Okay, thank you. And just kind of building off that, what would you say to employers or maybe even employees who are looking at this and considering picking up some of these tests to have a higher level of confidence in the workplace?
So you have to, any intervention here, you have to know the limitations of it, and that's the biggest thing with these testing type of programs. If you know the limitations of it, then it might be effective. So one is like we said, it cannot replace the fundamentals. It cannot replace people getting vaccinated. And knowing that with testing, especially in asymptomatic individuals, a negative test does not necessarily rule out COVID. It certainly doesn't rule out COVID at a later date, even a day later. So you have to know the limitations. So, it adds a layer of protection, but it certainly doesn't remove risk. And so you have to take it in context as it's just an added layer, but it only works if it's part of that multi-layered process.
From the Winnipeg Sun, Scott.
Hi, good afternoon, Dr. Roussin. You made the claim earlier that other provinces, potentially didn't account for the Delta variant. Do we know that for sure? And do we know that those plans weren't at least adjusted for the Delta variant?
They've adjusted over time, but when someone asked me about sort of the original targets that were set out, and a lot of those provinces had targets developed at a time when Delta was known, but we weren't we didn't know what we know about it now. I think certainly as they're reopening, I'm sure all they are considering the effects of Delta variant. But when we talked about why our targets were so higher, and that's just because our plans came out much later, and so we had much more Delta activity than when those original plans came out.
All right, thanks for that. You say Wednesday, we're going to hear about reopening. How difficult of a sell is it going to be to Manitobans to have such, maybe narrow reopening plans, compared to the provinces next to us? And I guess kind of a second question to that is, why release a reopening plan then, that is, vague on one side, specific on the other, and where the goalposts can effectively just kind of move on a dime?
Yeah, so I think it's been a challenge all along with the restrictions, and you've seen from our polls that we do that there's Manitobans that feel there shouldn't be any restrictions. There's many that feel we should have tighter restrictions. So it's always a challenge with that, and certainly what's happening in other jurisdictions is relevant to us. It's relevant to Manitobans. So we'll have to, like I say, we're monitoring those things quite closely. And then, kind of like I mentioned about the goalposts on there, the vaccine uptake sort of gives us an ability to set those targets, to hit the 70, the 25. The other sort of measures are real tough to have a significant goalpost, like a specific number of people in hospital, a specific test positivity, a specific number of cases. There's so many variables in there that to set those goalposts out, we're setting up to not necessarily rely on them even if we hit those targets, just because there's so much interworking between those variables. So that's why we didn't have the specific numbers, because we don't really have a specific number. We look at a number of factors all rolled up, how they're interacting, our trends, and then move from there.
From CBC Radio Canada, Alexia.
Hi, Dr. Roussin. I was wondering if you could comment on pausing appointments for 12 to 17. Why not keep the available Pfizer doses for younger people and ask older Manitobans to have Moderna instead for their second shot, instead of pausing appointments for 12 to 17?
Yeah, and so I think the vaccine task force has done tremendous work to get needles into arms of Manitobans, and I'm sure they consider the logistics of a number of scenarios. So we can pose that question better to them, but you can see that we've met our vaccine targets ahead of schedule, and so our rollout continues to move quite nicely.
Thank you. I was also wondering why offer walk-in vaccination with Pfizer, like at the Shoppers in Osborne today, while there is a supply shortage. Why not with Moderna and keep Pfizer for people with appointments in July?
Well, we're not concerned about interchanging those vaccines, so I'm not sure if that's kind of what the question is at. So we're going to use the vaccine that we have available. We know that they're interchangeable should something arise, a need arise for that. So again, our vaccine rollout is moving, and we're ahead of schedule.
Our final reporter this afternoon from CBC Manitoba, Marina.
Good afternoon, Dr. Roussin. Manitoba has been criticized throughout this pandemic for not releasing COVID-19 transmission data. Now you've released some, and it shows that workplaces are the main source of COVID spread that we've seen over the last half a year. But it was only in the midst of the third wave that the province actually warned workplaces that they would face fines if they didn't let their employees stay at home. So knowing what you did, why did you not release this data sooner on transmission or put restrictions on workplaces sooner?
Well, we've had restrictions on a number of workplaces and many of the waves, and we've always had close workings with workplaces, workplace safety and health, right? And so we've investigated outbreaks, we've investigated clusters, we've provided public health advice. So there's a lot of work that has been done. We know that a lot of transmission has occurred in gatherings, social gatherings and households. We certainly see outbreaks and transmission occur in workplaces or things associated with workplaces, carpooling and such. And then remember, when you have restrictions, when you're starting to talk about proportion related to transmission, that proportion will no doubt go up whenever you have significant restrictions in place, right? So we don't have many places right now to allow for transmission other than workplaces. So of course the proportion of transmission will increase in those areas because everything else is closed right now. So it's we've always been aware of where this virus transmits. It's indoor, prolonged contact, and so we've had a lot of safety protocols for workplaces. We've worked with them quite a bit. So it's nothing that's necessarily new. It's just we had a more strict approach to it, knowing that we always had the ability to close a workplace for public health reasons.
Can you provide us some more information? What are the main workplaces that we have seen are the spreaders?
Like the specific workplaces?
Just in general, the types of workplaces.
Well, it's varied. So we've seen it in factory settings. We've seen it in retail. We've seen it in the hospitality area. So it's what we know about this virus, right? Prolonged indoor contact. We can see transmission.
Thank you, Doctor. Thank you, everyone. This concludes our media briefing.